Hi, and we're live there, so we gotta go live over here. Where I do a little dance because I know some people can see me right now. Okay, perfect. All right, we are live.
Woohoo!
Hello, everyone. Welcome. I am Dr. Nicole Smith with Anti-Gravity Wellness, and today I have with me Aleah from Curve Appeal. She is one of my dear friends. She was actually my preceptor when I was an undergrad little baby nurse. And I was so impressed by her. I was like, when I grow up, I'm going to be just like Aleah.
And I remember
nurse.
those days.
Yeah.
You are. You are super doctor now.
So we have her on today to talk about her practice, Curve Appeal, which is amazing. She has a med spa and has all these different services. So I'm going to let her dive into who she is, how she started Curve Appeal, her background, and go from there.
Well, hello. My name's Aleah, like Nicole said, and I do own Curve Appeal in Kennewick, Washington. Also, like Nicole said, I've been in the nursing field for a very long time, over 2 decades, which is crazy, but it's true. And I kind of got into body contouring first. And I wouldn't really say that's really a med spa service, but it is. I didn't know that when I started. I had zero idea what I was truly getting myself into. But a friend of mine went to Mexico, had surgery, and she really needed lymphatic drainage, which at the time wasn't around very much in the Tri-Cities area. So we did a lot of research, and I wanted to learn how to do this so I could help people better coming back from surgery. Never in a gazillion years did I think I was going to have my own business, let alone a med spa business, ever. Like, ever. I thought I'd be a nurse on the floor forever and ever. But I learned body contouring at that time. We got her through her recovery period. And I started doing body contouring out of my basement, actually. I would work 12s at the hospital and 12s out of my basement. But it was a lot of fun and I learned a lot. And then I went to a body contouring conference in Las Vegas in March of 2023, almost 2 years ago. And I learned what a wee little baby thing I was doing comparatively. I was amongst millionaires of huge med spas around the United States. So I learned that I could do a lot more. And as I ventured out of my basement, I started dabbling into lasers and I fell in love with laser treatments. The things that you could do with laser treatments to help people feel better about themselves is gargantuan. And it's like a rabbit hole. When you learn a little bit, you just keep wanting to learn more and more and more and more. I love lasers now, and I still do body contouring, so it's kind of a well-rounded little med spa. It's very small, no employees. I try to keep my overhead low so I could make it more affordable for services for my clients. My biggest investment is my equipment, whereas some of the bigger med spas, they have a huge building and 20 employees, and a lot of their monies or the cost of treatments go towards funding a big building and their 20 employees, where at Curve Appeal, your monies go towards funding my equipment. So, and paying me.
Yeah, and training. How long ago was that? You went to some really big conference. Was that the one that was in Vegas?
Yeah. That was almost 2 years.
Oh, okay. Yeah. Okay. Wasn't there another one too? I don't remember.
Well, I went to Colorado to learn lasers. Yeah. There was the Art of the Skin in December of last year in Scottsdale. That was amazing. That's all laser related. Yeah.
Yeah. I remember you going and then you coming back and you're just like, oh,
yes. Yes. Well, we bought a new machine at Art of the Skin last year. We just bought another machine for Halloween. So yeah. Yeah. It's exciting to buy new equipment.
Yeah. Upgrading it. And
yeah.
Having all the things.
Truly giving my clients like the best treatment that is possibly out there for an affordable price is like my passion. Everybody should be able to afford to look and feel their best. There should not be a limited price tag, on some of these treatments. I mean, it's it's my passion to make it more affordable for people.
I love that.
Yeah.
That's awesome. So what, you kind of talked about how your friend came back and needed lymphatic drainage and stuff. So what was your journey to go from nursing to this? Like, what was nursing lacking that you wasn't fulfilling what you needed in your soul? And then how you transitioned into this, and how is that filling that gap?
Well, I loved being a nurse. I did. I loved everything about it. I loved helping people feel better. I loved helping people get over cancer. I was oncology for 5 years. What really changed me was working through COVID. It was very eye-opening. At the time, I was the house supervisor, one of the house supervisors for Lourdes. And there was a lot of, communication over the whole state, in regards to bed availability and closing versus not closing and staffing shortages. And as a house supervisor, you kind of have to make sure all these pieces keep moving, so the hospital could stay functional. And it was just a lot to see, and I learned a lot. And I just felt like I could help people better in a different realm than what I was doing there. So, and as you know, like in the healthcare field, you feel so undervalued. And during that time, they were paying other people bucket loads of money to come in. And most of the time, those people didn't even stay. But they weren't loyal to the staff that was loyal to them. And that was really hard. So I felt very undervalued. I brought a lot of experience and knowledge to where I was. And I just didn't feel like they cared, really. So it's hard to continue to bring all this knowledge and care to a place that just really doesn't fulfill that cup for you anymore. They don't give that back to their employees, which is really hard to watch, because there are some great nurses and aides and doctors around that are just all kind of feeling the same during that period. I don't know if it's changed, because I've been out now for 2 years out of the, acute care setting. So I'm no longer in it.
I can tell you, still being in it, it's not changed.
No. So yeah, helping people in a different way. It's very fulfilling for me. So much more so than being at the hospital.
Yeah. Kind of similar. Not feeling appreciated, being pushed to do more with not getting any reimbursement or anything to compensate for the extra work. And it's like, and then not being able to care for patients the way that I wanted to, like going, because I got to do everything 120%, right? And really feeling kind of hogtied on some things. And I was like, this is ridiculous, and it's all about their bottom line and what they think is, so it just got so frustrating. And I'm like, you know what? No, there's better ways to do this.
There is better ways.
Yeah. I think it's important for people that have been working in medicine to either, be entrepreneurs or get into like administration and things like that, because we have a different perspective, like being at the bedside and working with patients, because it trickles down, it's,
absolutely,
their treatment of their staff, and then the treatment of the patients, it's all one and the same. And it just gets so frustrating. I'm like, why don't you understand this? It seems like a simple concept.
Yeah, for some. And I mean, those that have never worked the floor, they're in those positions to make those kind of decisions for a healthcare organization or just a floor. It's really challenging, because I feel like they really don't understand the flow or what a real day is like, so trying to tell them doesn't get you anywhere either. So
no concept.
No concept. No.
It's a totally different realm.
It's very challenging.
Well, I'm glad you got out.
Now the only challenges I have is my own mind. No.
Constantly. All right. So we got some good questions on here. How do your treatments help women in perimenopause and menopause who are navigating skin and body changes? Like,
that's a big question.
Face falling and the wrinkles and the
that's a big question. So there's lots of ways you go about that. me in particular, like I don't care for Botox, although Botox is offered at Curve Appeal because I am not like everybody else. I mean, some people like Botox. You could do laser treatments to rebuild the collagen and elastin in your face because, as we age, we lose big percentages of that after 30, which sucks. What I can say is if you start younger with the laser treatments, chances are you won't lose the bigger percentage of collagen and elastin because you're constantly rebuilding it. So if you're just beginning to get fine lines, it would be a great time to start doing some prep work. Just a laser treatment or two. You wouldn't need like a whole series of laser treatments, but just to continue to build the collagen and elastin would help prevent the wrinkles or the saggy skin. Now, people that have already gone through menopause, that's a different story. That does take a series of laser treatments to regain some of that collagen and elastin. Are you ever going to look like you're 20 again? Probably not without Botox, but will you look a lot younger? Absolutely. I mean, laser treatments just turn back the hands of time. I love them. I will laser my face forever. I mean, I've earned these trenches. I call them my what the hell trenches up here from all the years in the hospital. But they've gotten less. They've gotten less. I refuse to Botox my forehead, really.
Yeah.
But a few more resurface treatments, and I think they'll be a lot better. Yeah. So, aging, menopause, perimenopause, you lose collagen and elastin. Laser treatments are good for people that work out a lot and they seem to not lose a certain area of fat. That's where body contouring would come in. That would be a good asset to have in your little arsenal of burning fat is body contouring because you can target certain areas, which is great.
It's the only way that I've ever seen that actually be successful. So you guys got to go to her website, curveappeal.com, and go see her before and afters because it's crazy. It's like normally can you spot reduce in the gym? No, you cannot. Like your body genetically will lose weight the way it's going to lose weight. And that can change over time too. As we get older, you notice that we start to have that belly pooch and it can be very difficult to get rid of until you go to Aleah.
Yeah.
Does a few treatments on you and it's like, oh, hello.
Yes, we could do all the things. So that's when it's really fun. When you have this very active, healthy person. Those are my favorite clients because they're going to get the best results. I did a comparison once of two people. They were not that far apart in age, but one had this like dead set workout routine. She increased her protein after we had a discussion about diet and exercise. Wow. She was also, she was already a very healthy, active person, but she increased her protein intake. She stayed steady on her workouts and she almost had a 6-pack by the time we were done with her sessions. Flip side, I had a client very similar in size. They were like a ½ inch off in the waist, not much difference. She did not work out at all. And she was already very restricted on her diet because she had allergies. And she had great results as well, but you could definitely tell a difference when somebody is actively working out and increased protein intake versus somebody that just stayed true to life, which is fine. They were both good, but definite difference, So
it'd be beneficial for both those who are training and working out and those who don't do that.
Yeah, it works for both people. It really does.
Yeah.
It's very eye-opening to compare, and they started around the same time. So I did it in my, for my own.
Your little case study.
Yes, my own little personal case study to see what would happen. And it was kind of neat to see. So
have you seen them follow up? Are they maintaining their?
Yes. Yeah. Yes. All the fat loss is permanent when you do body contouring, unless you eat it back, just like surgical liposuction. Your fat cell will grow and shrink as much as you eat it to grow or shrink. So you could get them sucked out, or you could, have them obliterated with body contouring and your body will excrete them. But if you eat to make them bigger, they will get bigger. Just
body goes, okay.
Yeah, I will grow.
Yeah. So, I was curious about that. Okay. we kind of talked about. Oh, okay. So what would you, so this question is, many women experience hormonal shifts that impact their skin texture, tone, and elasticity. I've really been noticing that too, like different little bumps and things that I never had before. And I swear to God, dermatology is just like, they're like, oh, yeah, you're just getting old. I mean, you can go next door and get that taken care of, but it's going to come right back. And I'm like, you're not very encouraging. What am I doing here? Thanks, guys. So RF microneedling versus Botox versus laser, like which ones kind of help with like which, like say someone, I'm like, okay, let's just use me as a case study. I come in and I'm like, I would love to like have the texture be smooth again and nice, even though it's not that bad, I know. But so what would we recommend to help with texture?
So any texture issues, unless it's wrinkles, Botox is not going to help you. Botox, is a neurotoxin. It freezes those muscles so they don't really move, and it makes your skin look like glass, right?
Plastics, you don't.
But if your skin already has some texture issues, it's not going to fix those. So really, if you have bad skin and wrinkles, really, you would probably want the combo treatment of laser treatments and Botox, which you can do both. If it's just a texture issue that you're concerned with, and you do have nice skin, more RF microneedling or a laser treatment called Resurfix would be ideal for that, because it would smooth out all that texture issue, and it does help build collagen and elastin. So you would still have facial movement because there's no neurotoxins in your face, so you could still express yourself, but your skin would be smooth, tighter, brighter. And that's the biggest difference. Like you can take care of wrinkles with Botox, but you can't really correct scarring or texture issues when it comes to Botox. That would be more laser or RF microneedling.
Fascinating. Okay.
Yeah.
This is a good conversation. I love this. We need to like get all the down low on this. Okay. Okay. So body contouring, which I have done with her, by the way. She like fixed my legs. I gotta go back because it's been a while. But and weight fluctuations don't necessarily help if you go up and down and things kind of come back. But I am very prone, and a lot of women are, because of genetics and the way that our collagen sits. You'll notice men don't have cellulite. Women, it doesn't matter our size, we can all have some cellulite. So even when I'm super lean, I still have some cellulite there, as there's more fat accumulation there's more bumps. So but the amazing thing that I found when we did the body contouring on my legs was I could feel the fascia underneath my legs was very bumpy. It almost felt like a washboard underneath there. I'm like, that's probably not good. And there's nothing I could do with like massaging, rolling, or anything like that to get rid of it. And then after one session, I ran my hand over my thigh and I was like, oh my God, it's gone. She fixed it. So I like actually got in there and like broke up all that, fascia and that gnarliness. So that was so amazing. So it's, it's becoming increasingly more popular. So how can it benefit women in midlife who are working on reclaiming their vitality and their confidence?
Oh, yeah. Well, I mean, it's like magic. You lay on the table. No, I'm kidding. It helps women reclaim their confidence because they feel better about themselves, ultimately. You look at yourself every day. So I really try to encourage my clients, like, don't run home after the first session and like nitpick yourself in the mirror, because that's going to be terrible. What I want you to do is wait until the third session. We're going to do pictures, and I will put them side by side right in front of you, and you could see the biggest difference. And pictures say 1,000 words, right? I always measure. I always do pictures, and we do pictures after every third session. So some clients will do 6 sessions, take a break, and come back and do 6 more. They have the best results, obviously, if they have that much to lose. Sometimes I don't let clients come back for 6 more because they don't have enough. And for the cost, it just doesn't pay off. It's just, I have a few clients I've wanted to come back for just like a smidge. I'm like, no. No, but they gain their confidence back. They look better. They can see that there's been changes in their curvature of their body. Their tummy's flatter. Their back is thinner, the definition between their back and their bottom is more prevalent. Their love handles shrink. I mean, like all the things that we pick ourselves apart about or make sure we can't see when we're wearing something, particular, they feel really good in their bodies. And I love result day just as much as they do, I think.
That's so amazing. And I kind of had this argument with my husband because I've done Botox once and just like a tiny little bit. And actually, it really helped with my stress levels. It's like, oh, when I can't furrow my brow, like I can't get stressed as much. So I was like, well, there's benefit for me. But he is very opposed to like plastic surgery and stuff like that. He's like, oh, don't ever do that. Just like let it happen. And I'm like, yeah, but at the same time, I feel like it's so hard for women, and especially we hit 30 and then 35, and then 40, you're like, what is going on?
Right. 40 is a big deal.
I was just watching a dermatologist on TikTok, and I freaking love her. I'll have to send you her link. But she was talking, there's literally like these stages that we go through where all of a sudden, and it's almost like overnight, you wake up and you're like, what happened to my face? What is this? Like this new little thing that happened or your body and something. And it can be very, very demoralizing. And I've heard stories too of women who've had, maybe just a little bit of Botox or something done to help them kind of regain that a little bit. And then that was the Kickstarter to maybe starting to take care of themselves in other ways, eating better, getting more hydration, maybe getting out of a bad relationship that was toxic. It was just amazing how these things can really compound and make a huge difference for people's lives. Yeah.
It's huge. I mean, the better you feel, the more you're going to take care of yourself, right? Whether it be physically, mentally, emotionally. I think it's all very important. And we have a little bit of everything at Curve Appeal. I mean, my bathroom is just full of good stuff. I have a whole wall of just good stuff that you could read to feel better about yourself while you're going potty. And we talk about diet and exercise and physical activity during body contouring. We talk about things even for laser hair removal, like there's certain things you can't do. So like if you want treatments, then, coordinate, your schedule, make sure that you're not going to have a whole lot of friction in that area that you're getting lasered that day or for 48 hours or so, so I think it's really important for people to do things that make them feel better, but to not stop doing other things just because they're getting a treatment. So trying to align people's schedule to make sure everything can fall into place and they get the best treatment and the best results for them. They just feel really good about themselves. And it is a snowball effect.
It is. Yeah. I think, and it's the same, like it's a little bit faster than, or even complementing going to the gym. But taking care of yourself and doing these types of things, it sends a message to yourself and also to everyone else around you that you matter. And I think that's just so huge. And especially as we get older, we are typically nurses, we sacrifice ourselves for everybody else around us because that's what we do. Like wouldn't even take pee breaks. I mean, it was like the running joke, I
don't really need to eat today. It's fine.
I don't need to eat. I used to restroom within like 12 hours and I'm actually going to stay late. So I was like,
they dropped off a granola bar for us earlier. I'll just eat that.
Perfect. I know. So we got very used to doing this. So, and I think that becomes even more important going into your 40s and in your 50s. It's like, now is the time to take care of yourself.
Yes, absolutely.
Like,
don't let yourself go to the point that you just don't feel good about yourself. There is no point in doing that because it's going to take you so much longer to come back from that. Rather than just starting when you're just starting to notice or feeling a little bit of, I don't like this, or I want to get this worked on, or maybe I should start going to the gym, or whatever it may be. Just start when you just feel a little bit bad about that one thing. Don't wait until there's a bunch of things because it's very overwhelming to start.
Yes. Yeah. Although that's what we're here for. So if you get to that point, we are here. I got it. Okay. Hair changes, like increased facial hair.
Oh yeah.
Isn't this fun? Like it stops here and then comes here.
Everywhere else.
Where are these little whiskers coming
Everywhere
from? So electrolysis or hair removal at Curve Appeal. How does all that work? And like how many treatments would I need to come in for my face? And is it different than the bikini area? And what about the back of my legs?
That's a lot of questions, Nicole.
I know. I'm asking for a friend.
So hair removal at Curve Appeal, there are a couple different options. Well, a few, but one I don't use at all. So electrolysis is probably the slowest, but it is the only permanent hair removal. Electrolysis is like a science project on everybody. I have a blend machine, so it does a galvanized current and a heat, and under your skin with your body chemicals, it creates lye. And so it never produces hair in that spot again. So you follow the hair, it's one hair follicle at a time. You follow the hair follicle down and you zap it. It's about 8 seconds per hair. But then that hair is dead. Laser. I did just buy a new laser. I have a diode and now I have a YAG with an Alex. The diode only hits the melanin. And it took about 8 to 12 treatments to get to clinical endpoint, which is 90 to 100% hair reduction. And with the diode, hair can come back. It might take 5, 10, 12 years, but hair will grow back. It's not permanent. When it does come back, it'll be finer and less, but it will come back. And the YAG laser, my new Splendor X, I'm in love with it already. I haven't even fired it yet. It just got here today. That's what I did before I came here. Was look at it and no, they got to calibrate it and all the good stuff. It takes about 3 hours to set up that laser. And so it's a YAG and an Alex. So it works on the hair follicle in 2 ways. It hits the melanin and it hits the blood supply of the hair. So it's 30% more effective. My diode took 8 to 12. This will take about 6 treatments. This also hits any color hair. So you could be a blondie and still get good results. Whereas the diode, the darker the better. The only color it will not hit color is white. The white gray hair, the white hair, because there's no melanin in it. So then, for people, let's say, I don't know, they had an armpit or something and they had a few white hairs, you could just zap those with electrolysis. But any hair removal takes multiple sessions. The Splendor X is the fastest to being at clinical endpoint with the 6 treatments once a month. So it's 6 months. If you start today, your last treatment would be April. You would be done before summer. But electrolysis is all chair time. So it's by minute. You pay by minute, not by session. It's very different. And it's different for everybody because the hair can only die in the anagen phase. And so you get a fraction of the hair, whatever hair is in the anagen phase, and you don't know. It's like Christmas because you just don't know where the hairs are. And it doesn't matter. It doesn't matter on length or time. It's all the hair phase of the hair. There's 3 phases of the hair. We can only die in one phase. So that's why it takes multiple sessions because you're getting a fraction of the hair at a time. That's why you have to wait in between treatments for laser electrolysis. You could do weekly. So up front, electrolysis is more expensive, but it's permanent hair reduction. And down the road, you'll never come in. Or laser, it's at Curve Appeal, it's very affordable. My laser hair removal prices are like 15 years old. I did that on purpose. Where I learned lasers was in Colorado, and they have not raised their prices in 15 years. And they're booked out 3 to 4 months. So I figured if they could do it, I could do it. And this is how I'm going to make it affordable for my people, for my clients. But laser hair removal is very affordable at Curve Appeal. I got packages of 6, or you could pay for a single session, but still it's a process. You still have to wait 4 weeks in between treatments. Electrolysis can be up to weekly, bi-weekly. Just depends on how fast you want to go and how fast you heal. But it does leave, with electrolysis, it does leave like red bumps, and you can get a little swollen because we're producing lye and your body's going to react to that. Right. Just natural. Right. So most people heal within 24 hours and it's fine with no swelling and no discomfort after that. But laser is a little bit different, a little bit more uncomfortable unless you're using the Splinter X because there's no pain with that one. But the diode's a little bit more snappy, like a rubber band. Yeah, lots of options. The option 4 that I talk about that I never use is IPL. I would never use an IPL for laser hair removal. It's just not as effective. And when I have a machine like the Splinter X sitting in there, why would I use something less effective?
Yeah.
Never.
That's interesting. Yeah, I don't know enough about it. I just heard one little blip about like IPL. You got to be careful because the machine needs to be calibrated properly, and some people will get burned. Da, 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 da. And that's honestly one of the reasons why, like, I will send everyone to you and I trust you. First of all, like, I worked with you and I know your quality and how, like, your standards are like ridiculous. So,
Thank you. Yes.
I know that that's still the case. So.
Mhm.
So I trust her that she is going to make sure that you're safe and that you get the best treatment possible. And she explains everything that's going on. She follows up really well. She gives you her friggin' cell phone number. So you like text her if you have any problems.
Yep.
So, very, very good care. And you never know, walking into some of these med spa places, like it can be a little shady and you just don't know. Like,
you don't know.
How would you? So, well, that's kind of skipping ahead, but
right.
Since we're kind of talking about that, how would you know what a good place to go? Like, what are we looking for?
Definitely always do a consultation, you know.
I'll just walk in and be like, yeah, let's laser.
Yeah, definitely always do a consultation. I mean, sometimes I do get ahead of myself because I get really excited. I love doing these treatments. And, you know, if you've had previous experience and you just need to touch up laser hair removal, then yeah, come on in. We'll just do it. But if you're unsure and you've never been to a med spa before, I will say Curve Appeal is very different than a typical med spa. Again, we're not a huge, big building. Okay, it's not overwhelming. You could touch anything when you come in. You do not have to be dressed to the nines to walk into Curve Appeal. You can come in sweats. I don't care. Like, however you're more comfortable. I want you to be as comfortable as possible. Because some of these treatments are a little outside the box, you know, especially doing a Brazilian or a bikini, or if there's some scarring issues that you're not very proud of. Like, some of them don't feel good. So I want you to feel as comfortable as possible coming in. But always get the consultation, you know, check out the vibe. They have got to be able to answer your questions. But if they are not able to answer your questions, I would seek an alternative place. They should be able to answer questions.
Yeah.
Laser techs. I mean, the bigger med spas, they have people that are just, you know, laser techs, estheticians that run lasers. I think it's really important that everybody has a base education to be able to answer questions in regards to the treatment that you're there for. Sometimes they can't. And so I would be sure you check out other places. Do your own due diligence. They should be able to educate you on the treatment, educate you on aftercare. My aftercare gets sent out electronically, sometimes even before the treatment, so they know what they need to do for the bigger laser treatments. Let's see. Education, like, we all start somewhere. So I hate to say like experience, right? I have 2 years of experience where somebody else might have 15 years of experience, but it should all like come out when they're able to answer your questions properly. They're able to educate you on the treatment properly, and they're able to give you proper aftercare.
Little bedside manner.
Yeah, all those things. I mean, you could have 15 years experience and still not be a master at your craft. You could have 2 years of experience when you're very focused on a limited amount of treatments and be a master of your craft.
Absolutely,
so it really depends on what they're going for. If they're going for exquisite results, or are they just going to this place because it's bougie, you know, like hopefully you want exquisite results. It's money. And if you're going to pay that kind of money, you want the best results for yourself.
Absolutely.
Yeah,
for sure. Okay. So we kind of talked about that. Oh, I like this one. What advice would you give to women who are hesitant to explore med spa services but are curious about their benefits?
Oh, yeah. Well, look at people's websites. If you're not ready to actually go into a med spa, again, some med spas can be very overwhelming because the way they're presented, right? They're huge. Most of them, not me, but most of them are huge. I'm very laid back. low key. It's easy. It's easy. It's clean. It's cute. But it's easy to come into Curve Appeal. You feel relaxed at Curve Appeal. But if you're hesitant to even walk into a med spa because, you don't feel like you fit into one of those places or whatever, look at websites. There should be plenty of information on a website at what you're going for. I know my website contains a lot of information for those people that like to read before they get anything done. It's very informative.
I was looking at your blog section. I love it. You are very thorough in like talking about all the different services and what they're for. And I just love that. So
thank you.
Go check out our blog.
Yeah, there's lots of information there. And for the readers that really like to do their research before they get any treatments done, it's great when med spas have a lot of information. Some med spas don't. They just have a very short little blurb about a service they do or the person performing the service. So again, do your own due diligence. Don't be somewhere that you're not comfortable with, and definitely don't get anything done when they can't explain it to you.
Right. Like, you know what you're doing. All right. I think you kind of talked about that. Oh, are there any misconceptions about med spa treatments that you'd like to clear up?
Yeah, they don't have to cost a small fortune. Not a Curve Appeal anyway.
A billionaire to afford it.
I would say like most anything in the med spa will give you great results. But if you want like Hollywood, like that's all surgical. So if you're a non-surgical girly, then expectations just need to be stated, right?
Yeah.
Like body contouring, you're not going to have the tightest, fittest little tummy doing 6 sessions of 4D lipo at Curve Appeal. You're not. If you want that, then go have a tummy tuck if that's your outcome that you're wanting. Now, if you don't want surgery, then the best bet is a 4D lipo series and maybe some RF microneedling to tighten the skin. That's going to give you a great outcome with no downtime and less than a traditional tummy tuck with no time off work. So there is some great benefits to non-surgical options. But yes, med spa services do not have to cost a small fortune. That is a misconception. You should have great skincare, and oil of Olay is not it, but great skincare to be paired with your treatments. And, again, going back to cost and affordability of skincare, if you're paying $20 for a thing of moisturizer and it's going to last you a month, that's expensive. Just keep that in mind. Great skincare, you will need less to do what it needs to do. So you might pay $60 or $80 for the container, but it's going to last you 5 or 6 months. So do the math. It's less than $20 a month. So you don't need a gob ton of good skincare to keep your skin moisturized or help with wrinkles, anti-aging, or, I have some good stuff at Curve Appeal, but just be mindful of ingredients too. I'm a big one with ingredients.
Yeah. She was the one who introduced me to the Yucca app, and then I threw out everything I owned.
She texted me later that day. She's like, I threw out half my kitchen. Sorry.
In my bathroom. But that's so true. Like, especially when we were younger, we would do the, other brands. And because it was cheap at the time, but when you actually it feels really expensive, but you need like two little drops and it spreads so well across everything and lasts. And it just, it makes such a huge difference when you have like really good quality ingredients and everything. Good
quality stuff goes a long way. Yes. So just do the math. You might buy one a year.
Absolutely. Yeah.
Maybe 2.
Well, and I love too that, because I've gone to other spas and they try and push like an entire pharmacy at me. I'm like, do I look wealthy? Like, what's going on here? Or they just make it look, you need, you need this and this. And I'm like, oh, thank you. That's, making me feel great about myself right now. And then you walk out of there like, $3 later and you're like, oh, okay, well, that hurt. Just on the skincare products. And I was like, oh, I'm coming back later to get an actual treatment done. And I love that you already touched on that you are not going to push services or things on people just because, like, we're business owners. We need to make money. We got to eat. But we're also like, what's in the best interest of our clients? Because that also translates into, loyalty from them too, the knowing that we're not trying to just get your money for no reason. Like if we recommend something, it's because it's really going to help you, and really we believe that it will benefit you to make this exchange, and it's not just for our benefit.
Absolutely.
That's huge, because I also get that feeling from a lot of spas that I've been in, where I'm like, oh gosh, I'm trying to get out of here. Like, I want to get what I want to get, but I want to get out of here before you push something else on me and I make an impulse buy that I shouldn't. My husband's like, buy. I don't know.
No. Yeah, it happens. I really try not to be that person, because unless I truly believe like what your desire at the end is, like, I could truly provide that for you, like 100%. I'm not pushy. I'm the worst salesperson ever.
I know.
It's like, okay.
I know. So
okay.
I've been told I need to hire a salesperson because they're way better than me. I'm like, I'm sure.
Like, can I just give it away?
I know, right? I could. I really do. It's independently wealthy.
Eric hates it when I do that. I'm like, what?
I'm helping. I don't know.
I know, she's gonna feel so great. But you're giving it away. I'm like, oh, yeah. She bought one thing. That's terrible.
All right. And I was gonna check and see. I don't see any comments. Okay, perfect. So if StreamYard is actually hooked up properly. Do you have any offers or special recommendations or anything for our listeners who want to explore your services? Do you have like a...
Yeah. Well, I am doing the first 100 laser hair removal packages for their legs at 20% off. So the whole treatment, all 6 of them, would cost $12.90 to have your legs done, which is insanely low. Like, if you thought about doing laser hair removal on your legs, you cannot not afford to do this now, because it's just incredibly low. Usually legs are like close to $1,000 a session. Wow. Yeah. So you get 6 for $12.90. That's amazing. And BOGO's still going on. So that's select laser services, resurface, smooth glow, IPLs, and RF microneedling. Buy one area, get the second area 50% off. That has one more week, and then that's going to go away. So yeah. So I always say, if you're going to do your face, do your neck, because you don't want this looking 30 and this looking 60. Like, that does not match. It does not match. So it's very important in those instances to do 2 areas if you're doing your face and neck. Now, abdomen, for skin tightening, thighs, whatever. Those can be done separately. But if you're going to do your face, do your neck.
Yeah, makes sense.
Yes. Please.
Just on you, came here. And where can people find you and connect with you?
Well, I am on Facebook and Instagram, Curve Appeal TC for Instagram, and Curve Appeal on Facebook. My website is curveappealtc.com. Made it all real easy to find me. And you could always just shoot me a message on either of those platforms. I'm pretty responsive unless I'm with a client. That's the difference of Curve Appeal. When I'm with clients, you get my undivided attention. Like, your time is your time. There is no wait for your appointment, because I don't stack my clients on top of each other. So there's very seldom a time where you have to wait for me to be ready for you. I'm usually ready when you walk into the door. And you get my uninterrupted time for the time of your treatment. So you could ask any questions. We have good conversations. We get to know each other very well. I love to build relationships with my clients. Most of them feel freely text me questions about things, whether it's going to enhance their body contouring treatments or skincare things, or I love questions. I love that they want to do better for themselves. So I always encourage them to reach out. Sometimes it's a product question and I'll be like, well, what's the ingredients? 9 times out of 10, the first or second ingredient's alcohol, just put it back. Don't put that on your face. There is no need for that. And I also educate. I got really into oils for what they do to the skin, and that's very affordable. Tallow is another very affordable skin care product that helps with moisturizing, and moisturizing skin doesn't age as fast as dry skin. So
That's true.
if you young people keep your skin very moisturized as time goes on, the less aging will occur. So moisturizer is great. I do support small businesses here locally that I carry 1 Degree Healthy Tallow. I carry their products in-house. I make my own oils, and my medical grade skincare line is the cleanest. It's made in the cleanest pharmacy in the nation. It's the only 503B pharmacy in the nation, and they're in Florida. So there's no dyes or fillers in any of my skincare products.
Amazing.
Yeah.
So can people just like walk in and take a look at your little shop and like?
Well, I am by appointment only, so you can't just walk in.
Okay. So I was like, if you're on the back, there's nobody up.
Yeah, someday Eric's going to be my receptionist, but then maybe we can do walk-in things for products. But right now I'm by appointment only. You don't necessarily need to book an appointment to buy product. If you're interested to buy product, you could just shoot me a message and be like, hey, I want to pick up, or can I talk to you for a couple minutes and I'll tell you what time to come in, that I have a little break in between clients. I always seem to make those kind of things work. So
perfect.
Yeah.
Amazing.
This was great.
Yeah. Thank you so much for coming on.
Thanks.
Yeah, I learned so much. Oh my gosh. I kind of feel like we need to do an episode like in your little shop too. And like
totally
talk about all your stuff. And because I'm getting very much into the skincare in that time. Yeah. As things are changing. And I'm like watching that dermatology lady. She's 42 as well. And she's like, this right here, these are your gels. And I was like, oh God, do I have those?
In my 30s, I always said I was going to age gracefully. Like, I'm just going to age gracefully, kind of like what your husband tells you. But as I get older, I'm like, no, I'm not. I am not going to age gracefully. I want to be looking as young as I possibly can. I want to take as good of care of myself as I possibly can. Yes. So I can like go the duration, right? Yes. I don't want my body to hurt. Yeah. I want to be able to work out and be active. Mm-hmm. I have grandchildren, if you can believe it. I have 2. They're 2 and 5. But we took them to iPlay this last weekend. And thank goodness we've been back to the gym and working out, because I don't know if I would have survived iPlay. I was crawling through tubes and up ropes. And I'm just like, my goodness, we're getting a workout today. It was fun. I would suggest highly, if you think you want a day off from working out, just take your kids to iPlay.
Go play with them.
It is a workout. It was very fun though. Yeah, but yeah, awesome. Yeah. But I want to go the duration. I already have grandkids, and yes, I'm younger for nanny. That's what I'm called, nanny, not grandma. But I want to be able to be active with them for a very long time. Yeah. So I think, taking care of your body, taking care of your skin, and that helps you mentally and emotionally. I think it's very important.
Absolutely.
Yeah.
All right. Awesome conversation. Thank you so much.
Thanks for having
me. And I will have her information. I'm going to put it in the comments, and we are turning this into a podcast. So watch for that. I'll be posting that later. Thank you so much, everyone, for joining us today, and have a great rest of your week. Bye.
Bye.